In fracture management, the preliminary part is to confirm the diagnosis. Then we come to the management proper, or that is treatment proper. So the treatment proper consists of first aid. As you know, the fracture occurs without any timing or schedule. Naturally, these patients may not always come to us, to the outpatient department, to consult us. Or even before coming to the outpatient department also, they might have had some treatment elsewhere. So, one must know a little bit of first aid procedures before actually we start treating the patient. Without that, straight away we can't give the treatment, because by the time the patient comes to us, he may not be an empty stomach, he may not be knowing that there is a fracture, and he may not be ready for any surgery or, if necessary, manipulation under anesthesia. So, we have to give first aid. The site of injury may be home, school, road, or any other place. So one must know a few things about first aid. Here, whenever there is a fracture, most important thing is not to become panicky. Never become panicky when you see a fracture patient. That is, to see that the fracture fragments do not move about, causing more and more pain, and then what is known as neurogenic shock, and sometimes it may produce more bleeding also. And there will be, if the patient has got multiple fractures, they go into what is known as circulatory shock. So to prevent all that, we try to do splinting of the feet. Here, there are two types: improvised and ready-made. Nowadays, lot of ready-made splints are available, but very often all these things may not be available in the house or nearby. Then you have got to use your little bit of your ingenuity and make makeshift splints. For example, a scale is there or a paper is there, a newspaper could be. You can just put them into pieces like this and then tie it and put it around the neck. This is one simple improvised splint for children in the case of both bones fracture or elbow fracture, any of these things. Second thing is, you can just take off your tie or belt and then make use of it, or any of the things which are there which can be used more like slings. Well, I mean, this is splinting, otherwise slings. Most of the people in first aid, they try to teach the people about slings. So splinting and slings. So similarly, ready-made slings are also available now. They are not very costly. Anybody can just keep them in their houses or nearby. If you have a nearby shop, it's very easy to get these things. Otherwise, you can improvise. Any cloth, tie, any other things can be made use of to see to it that the upper limb doesn't move and produce more and more pain, and from pain, neurogenic shock. So in the case of the lower limb, don't allow the patient to walk. Keep support, a sandbag or rolled up towels or bed sheets, whatever you have by the side of the limb. So the limb is broken, don't allow them to fall on either side like this. So just support them. And most important thing is, should not make the patient bear the weight unless the possibility of a fracture is confirmed or otherwise by X-rays. In first aid, if more than multiple fractures are there, if they are associated with other injuries, patient may be unconscious or may shortly sinking. So for those people, or it may stop breathing. So for this, the very common ABC of first aid being taught everywhere. So some people who are first aid aware of that, they have got to use this thing. These three things are very important, and in most of the advanced countries, they have got very highly trained personnel. You just give a ring or inform them, they will be reaching the place of accident within 3 to 5 minutes. But in some of the developing countries and other poorer countries, we don't have such kind of facility. So one must know a few things about airway, breathing and circulation. Of course, if the trained personnel are available nearby, they will look after all these things. But in the absence of such facilities, one must know that airway doesn't get obstructed. Or this, must always to see that airway is kept by any foreign objects are there, remove them, don't allow the tongue to fall backwards, and try to lift the head like this upwards so that the tongue will not fall backwards. So these are minimum things. Clear the airway, then breathing. So breathing, as soon as the people suddenly may stop breathing. So you have to do artificial breathing. So this is done normally by trained people, by doing pressing the chest and all that, and if necessary, mouth to mouth breathing, adjust to the patient or somebody else nearby comes for your assistance. You have got to do this breathing. You see that the patient regains the breathing, because you don't allow the person or if the patient to wait too long for the person to recover breathing, it may be very late. So don't allow that to happen. So the third is C, circulation. Circulation means heart is not functioning and just come to sudden stop. It just happen, you see that heart starts beating again by doing CPR. So it takes care of both circulation as well as the heart. CPR means cardiopulmonary resuscitation. This CPR includes providing artificial respiration by way of external pressure or mouth-to-mouth breathing, and then pumping on the chest and compressing the heart. You have got to be a little bit trained in that to do these things. But quite often, if somebody who knows all these things are available, they may save the life of the patient. So, in multiple trauma, patient may suddenly go in for cardiac arrest and stopping of their breathing. So, for these people, the CPR is very, very essential. Of course, it's not a subject for discussion for orthopedic surgeons, but more for people who do first aid. But still, suddenly patient comes to the OP or the orthopedic department, then he stops breathing also. One must know what are the things to be done before we quickly take the patient to the ICU, where it will be taken care of by intensive cardiac or intensive care unit doctors or highly trained in their respective fields. They will be able to do the resuscitation. But one must know the fundamentals like these A, B, C should be restored at the earliest possible minute to prevent disaster.